Good morning, everyone, and welcome to the campus at the University of Arizona. We're coming to you live streaming on Facebook, and we're here at the Davis Athletic Center. And panelists, since we are social distancing and this is such a big, well-ventilated area, we can take our masks off. There we go, makes it a little bit easier to talk. This is the fourth in a series of weekly updates for not just the media, but for all of you at home. The intention is to keep people in the loop, to let you understand what our president, Dr. Robbins, is doing, backed by a huge number of staff and community members. He wants to make sure that come August, our faculty, our staff, and our students especially feel safe and as safe as possible coming back to campus. We'll do everything we can to minimize some of that exposure. Today, in addition to an update by Dr. Robbins, we're also going to be taking questions on the economic impact of the University of Arizona on our local community and elsewhere through innovation and technology and science. So let's get started. I'm going to introduce you to the panelists, and we're going to go left to right. First up is Dr. Richard Carmona. And Dr. Carmona, of course, is the 17th U.S. Surgeon General, best known for that. Next to Dr. Carmona, we have the Dean of the University of Arizona College of Medicine, Michael Abecassis. Got the name right, didn't I, Michael?
Right.
I did. Right next to the Dean of the College of Medicine is Betsy Cantwell, the Senior Vice President at the University for Research and Innovation. If it's new and groundbreaking, Vice President Cantwell will be supervising it. She's on top of that. We're also joined in the panel by Liesel Folks, the Senior Vice President for Academic Affairs and the university's provost. You might call her the champion of our students. She oversees all academic programs at the University of Arizona. And we're also going to be hearing from a student, Colin James Catefano. Close enough, right? Colin is a student studying for his PhD, and his background, his master's, is in public health. So he is working with other researchers to figure out what happens with the COVID virus once you've had it and it's gone. And finally, of course, we have our president, Dr. Robert Robbins. And Dr. Robbins is backed by a huge staff of people who are working hard every day to give him the best information possible on how we can re-enter campus come this fall. Dr. Robbins, it's all yours.
Okay, thank you, Nancy. Welcome everyone who joined in today, either through the live stream or here in person. We've got a lot to cover today. Things are moving very quickly. Liesel, I don't know, what's the number of days? 74 days before August 24th. And the point of these briefings is to update people and about where we are in that process. And we're moving very quickly to discuss the important issues about whether we were to come back to campus on August 24th. And if we did, what protection and safeguards we could provide to students, faculty, and staff. I would say the students are going to decide on their own. They're free to choose whether they come back or not. The faculty and staff, we've got some guidelines that we could talk about in terms of flexibility around whether they have circumstances that would encourage them to stay at home or whether they choose to stay at home, and we can have a discussion about that. We've got a lot of people to get to. This is a large panel. We can't get everyone up here, but I think that it's going to be a lot of good information, and I'm really looking forward, Colin, to your work and you speaking about it. Before I turn it back over to Nancy, I just wanted to point out that yesterday Dr. Cantwell led a discussion on campus, which was a nationwide discussion around Stop STEM. stop what we're doing. We're here to talk about how important research is, but I think yesterday was a really important day in terms of us stopping what we're doing in our labs and listening to those voices for social justice that maybe as we're moving quickly, we haven't listened to well enough. And I'm really proud of the work that we're doing in this area, and I hope that Dr. Cantwell will expand on how that went yesterday. Maybe you want to do that now?
Yeah, now might be a great time to do that. I don't know if I would call it pride, but the idea of this exercise is that all of us that participate in research around the world needed to take a pause, particularly in this country. So we converted every meeting and every activity that we were doing yesterday to a discussion about social justice, racial equity. Those conversations were exactly as the president said, the start, which means listening. We opened up our, since we don't have doors that people come in, we opened up our virtual doors, expanded the number of people that were allowed into our Zoom meetings, and really asked our research enterprise, which is very large at the University of Arizona, to express what they were thinking at the moment. We will do this repeatedly. This will become part of who we are and how we do it in research at the University of Arizona. Yesterday was just a start, and I am incredibly moved by the willingness of our community to come out of what could be a comfort zone and discuss for themselves how they see things, what their experiences are, and where they want us to move going forward.
Thank you so much. Let's get started with some of our discussion here. Dr. Carmona, one of the things that just baffles me is the amount of information coming into the task force. How do you grapple with that? How do you handle that extreme volume of information?
Well, it's a great question, Nancy, and it's one of the reasons that the president decided to use this incident command model, because there was so many faculty and so many groups involved in getting the right information. But then you have to operationalize that. You know, once you get that book, the playbook, as the president says, how do I put that together and get the operation? And it's ongoing. So it's not just it ends one day. And in fact, one of the things we did today was to show people what we do for the president, because every 24 hours he gets an update in what we call a sit rep, a situational report. And so the sit rep, this paper here, but you'll have it up, I think they're going to put it up on the screen, but it has all the data that's happened in its last 24 hours. It'll have in the county, the city, it will talk about neighboring states, and it will talk about who's been tested, how many cases we have, what is the morbidity and mortality, and a timeline of what's happening over time. And then we break it down so you'll see operations, and during the operations section, what's happening operationally, to be able to take all of the data that's coming from our Vice Provost folks and Betsy Cantwell in research, because we are a research university. And again, today, one of the reasons we have a student, again, because everything we do is student-centric. And Colin, in fact, is doing research on the long-term consequences of COVID. So we always want to feature that, because a lot of that research and a lot of the academic knowledge that is generated becomes part of our plan. And in every 24-hour period, we'll put this out and we'll speak about operations, logistics, planning. A safety officer will talk about the safety part of this and are we doing everything safely. A liaison officer that coordinates with the county and with the state health departments to make sure we're in sync with them. We have a finance section to figure out, when we have all of these plans, how do we pay for those plans to make sure that they get operationalized. And then Nancy, of course, as our PIO, or Public Information Officer, provides the last 24 hours of media for us, and it's all condensed into this one-page report so that the president every day knows just what's happened the last 24 hours as we're going along. It's a snapshot in time, but those snapshots will ultimately help to inform what decisions the president may make based on the trending information, incidence, prevalence of disease, and things like that that are in this report. So I'm just thrilled to be part of the team and to have such a robust team of academics, staff, and students who are all providing the answers to some of the more complex problems we have that will help the president make his best decision when the time comes.
Wonderful. Thank you, Dr. Carmona. Next up, we have the Dean of the U of A Medical School, Dr. Michael Abecasis. And hablas español, ¿verdad? Es la primer para ti.
Seguramente.
En uno de estos días vamos a hablar y hacer una entrevista totalmente en español.
Con gran
One of these
placer.
days, we're going to do an interview completely in Spanish, but for today, Dr. Abecasis, English would work. Tell me a little bit about the University of Arizona's College of Medicine. I know that it was established some 50 years ago, and today it's one of the leading universities when it comes to research and things like public health and primary care. How is the school kind of part of what's happening with the COVID-19?
Well, thank you for that question. So, the College of Medicine is under the broader umbrella of health sciences. So there are other colleges that are relevant to health sciences other than the College of Medicine. But the College of Medicine really stands at the intersection of a tripartite mission, which includes obviously education. We're teaching students and residents and others to practice medicine. Second is research, which is a critical mission as well, because we have to advance the science of medicine. And as relevant to COVID-19, that becomes a huge issue because there are obviously very significant issues that have to do with taking care of patients, prevention, identification, et cetera, et cetera. And then the kind of what we do at our core is we take care of patients. And so the clinical care component of the College of Medicine is really central to the other two. And so we're partnered with Banner Medicine in doing that, and so it becomes a very important relationship because all the faculty for Banner Medicine are faculty of the College of Medicine, and so that's obviously the link. And everything that we do, including, for example, education, our students are in clinical rotations. So we have to come to an agreement as to, what's safe for the students, but at the same time, how do we not compromise their ability to become physicians? So our third-year students went back to patient-facing rotations June 1st. Our fourth-year students went back 2 days ago on June 8th. And so that's a tough decision, because we're talking about students university-wide and when is it safe for them to come back, et cetera, et cetera. But if the education of medical students is to take care of patients, you can't just say, well, we're not going to expose them to any type of risk, because that's part of, we take an oath that says that we will take care of patients in spite of what risk we expose ourselves to. And so I think that the College of Medicine is positioned in a way that we really cut across these three missions.
As horrific and devastating as this COVID-19 pandemic has been to our country and the world, it is a teaching moment for your med school students, isn't it? And how are they adapting to that?
Well, yeah, I mean, it's a teaching moment in a lot of different ways. First of all, this is a pandemic that we haven't seen for many, many decades. And so, and hopefully will not see for a long time. So this is an opportunity to learn how to deal with, epidemics and pandemics. But it's also, I think our students have had to do a lot of reflection about, well, what is my risk in potentially seeing a patient that we may not know is infected with a very infectious virus. And am I willing to take that risk, and how much risk am I willing to take? So I think in addition to, and maybe part of dealing with a pandemic is that it causes our students to really think about what their careers are about, and the fact that, you know, we make a commitment to take care of patients no matter what. And so I think it is a really, I mean, I wish we didn't have it, but I think it's a great opportunity for our students.
It's life, isn't it?
It is.
Betsy Cantwell, excuse me. I know that you care very much about innovation and research, and that's primary in your life. But tell us a little bit more about what happened yesterday with that, with the day.
So I have spent most of my career working with particle physicists, so I'm deeply proud to say that there are 2 African-American particle physicists in the U.S. who got together a very short time ago. One is in academia and one is in a national lab, and created the idea for what is called #ShutdownSTEM and #ShutdownAcademia, really meant to happen fast and if nothing else, make us all stop what our regular research business is and ask different questions. In our case, we really needed to open the door and listen, and we will need to do that more often. But I would say the resonance across the research enterprise here at the University of Arizona has been remarkable and heartening, not because we know we're all good people who want to do good things, but because of as I said earlier, the willingness to stop and listen and think about what we need to do that's different than anything we've tried in the past. So the needle really moves here at the university.
Does the research continue? Has it been continuing throughout this entire period? Or tell us a little bit about the difficulties in trying to do research remotely.
That's the salient question. It's the one that always gets asked. So the short version of a very challenging story is we have on the order of 800 separate operating research groups, usually led by a principal investigator. They're large and small. They operate in everything from laboratories to field-based research to clinical or human-facing research. We were very fortunate that in January we had just conducted an exercise that we do every few years to make sure that the continuity of operations plans, it's COOPs, that just means that every research entity has looked at what's their safety portfolio, how are they thinking about how people are operating. This was really pre-pandemic. So we were well positioned during, as the pandemic became obvious, to first shut down everything, as we were asked to do, and then rapidly reopen about 20% of our research, that which had credibly could be called critical research and could demonstrate that everybody operating in whatever that research scenario was could meet CDC.
What kind of research was that?
So that's everything. So critical is a broad definition, but I like to give 3 examples because they really tell you the kinds of things we're thinking about. One is obviously COVID-19 related research, and the amount of COVID-19 related research that's going on at the University of Arizona has just skyrocketed since this pandemic became obvious, and a group of about 200 researchers from across the university, including business and law and the social sciences, came together in the COVID-19 research working group to work together. And they've bid many, many times and won awards. So our awards are going up there. Another one is we do hundreds of millions of dollars a year worth of NASA-funded space research. All of that has to be launched. Those launch dates are selected based on physics, not on other choices, which means you must meet the launch date. So in those cases, much of that research was able to continue because those researchers could demonstrate that they could maintain social distancing, they could do their work wearing masks, they could schedule all of the things that are necessary. And then the third one is a small but extremely important group of students for whom curtailing research immediately would actually prevent them from graduating. And so they were all young people whose graduation was either in May or at the end of the summer, and also could demonstrate that they could meet all of the requirements necessary for CDC guidelines. I will say, Nancy, because it's important, that we have now lifted that requirement for being declared critical research and are slowly but very surely reopening research at the University of Arizona campus. That means every single case you have to come in. You don't have to be declared critical research, but you have to demonstrate that you can meet all of the safety criteria for the CDC, and we review all of those criteria for each lab and slowly but surely approve. We're up to about 240 of our 800 research units are beginning to reopen now, and we're approving new checklists every week.
Wonderful. Things are moving forward.
They are.
Liesel, folk, hello.
Hi, Nancy.
I know, as the provost, your primary concern is the student, of course, and you oversee a lot of the academic programs. What are some of your concerns about what life is going to look like coming back this fall for the student?
Sure, Nancy. There's an enormous amount of effort going into answering that question, and it's a multifaceted question. I want to pick up on something though and tie together comments that Mike made and Betsy made. Mike talked about the importance of his students putting into practice their learning, and for his students that happens through clinical rotations. But I want to remind everybody that actually many of our degree programs involve what I would bundle together into the term experiential learning opportunities, which are placements where we put students into real-world situations and allow them to practice their skills, to develop real-world knowledge, to figure out how to operate and be effective in their chosen disciplines and fields. And that spans the gamut from research-intensive experiences of the kinds that Betsy already talked about. It includes clinical rotations of the kind that Mike already alluded to. It also involves placements for our students who are learning how to be teachers. They normally spend a lot of time working in schools. So across this enormous array of activities, right now we're trying to figure out how do we safely allow that training to continue, because for many of our degree programs, it's a required part of the degree program, and with good reason. It's a critical part of the student experience, and the last thing we would want to do is prevent our students from getting these really valuable experiences. So Nancy, we're working really hard on figuring out all these different situations so that students can have these experiences on campus and off campus with host institutions. Think about Banner Hospital. So we want to make sure that we know that our students are going to be able to operate safely, but that they're also able to get these experiences that are just so crucial to their development in their degree program, to their learning, but also are often the launch pads to them getting a great job when they graduate, which is more important than ever, I guess. But that's something we've been working on really hard. And that's, many of our students, of course, get those experiences in our own laboratories, so there's a really tight overlap there between the work Betsy's doing, trying so hard to get our research operation ramped back up and making sure that we have a safe way to integrate undergraduate and graduate students into that safe operating environment so they can continue with their studies.
Wow, some real challenging workarounds for everybody on this panel. We've talked a lot about the research that's going on in order to battle back this COVID-19 pandemic. But Colin is a researcher as well, but he is looking at something different. It is what happens to us after you've come down with the COVID-19 virus. What are you to expect of your body and your future? Colin, can you tell us a little bit more about your research?
Yeah, of course. So really, this research is a collaborative effort between public health researchers here in Mezcov at the University of Arizona, as well as our Phoenix campuses, and researchers up at ASU, where we're trying to create a statewide cohort of individuals who both have and have not had COVID-19, so that we can try to characterize the disease a little bit better so we can better protect the communities that we live in. Some of that includes just basic acute presentation of the illness, such as what are the common symptoms, how long does it usually last, anywhere from like household transmission, how does it affect children, just because there isn't a whole lot of research that's been done on that yet. But the more important aspect of the research we're trying to do is looking at those chronic sequelae that we might see. We know from previous research of other closely related coronaviruses such as SARS and MERS that there is a possibility for some of those patients who experience a severe illness with those infections to have lasting consequences that continue on years after they've recovered from that acute phase of the illness.
What kinds of things?
Specifically for MERS, if I'm remembering correctly, some patients from MERS, because it is largely a respiratory infection and it doesn't affect as many organ systems as SARS-CoV-2, which causes COVID, does, they have reductions in lung function that last about 3 years after they've actually recovered from their initial phase. With many of those, if you think about some of the special populations we have here and the chronic conditions that are really prevalent in our societies, those that already have reductions in lung function may not be able to have or sustain even more.
Wow. So
deficits.
this is groundbreaking research that will have an impact on people all over the world. Thank you. Dr. Robbins, one of the things before we open it up to the media is, can you talk a little bit about our athletes coming back? There is a group of athletes coming back to campus on Monday. What's gone into that planning and that decision that it's safe for them to come back?
Yeah, I think, Nancy, there's a 1 o'clock press conference that's going to talk about the athletes coming back to campus. So the Pac-12 presidents have gotten together to provide guidance, along with Larry Scott, the commissioner of the Pac-12, around what do we want to do as a conference in terms of bringing fall athletes. Importantly, basketball is not a fall sport, so there's all kind of concern about what's going to happen with the basketball program, because they would normally be coming back and practicing, and so they're not, only fall athletes are allowed to come back in a very slow, metered way. I think they're going to be like 25 to 50 athletes at a time over the next week, starting on Monday. And there's a very aggressive and innovative approach to testing not only the athletes, but I think, as Gene Block, the chancellor of UCLA, terms performers, those who need to be back on campus to do what they do, whether it's play on a field or dance in a theater or play an instrument or spin pottery in a studio, the ROTC students, the researchers that are going to be in the lab, both undergraduate and graduate students. These are individuals that need to be on campus or in a physical location to do their work. So there's going to be, it gives us a sort of dress rehearsal for August 24th if we were to decide to bring everyone back. And I want to continue to emphasize people will have a choice about that, in terms of the students can decide whether they want to come back to that face-to-face experience. And we're surveying, we're talking to the faculty about what their feelings are about that. Some people will just decide that it's not safe and they don't want to come back until there's a vaccine. Others may decide that they want to come back to their office, but they want to teach their courses in a remote online way. So the provost, the ICS team, all of the individuals at the university are working to try in the next 75, 74 days to make a decision. I think we've got to make a decision about that sooner. So I think we're down to the 50-day kind of, next 50 days are going to be important. And maybe Dr. Carmona and Dr. Abacasas could comment on the spike we're seeing in Arizona, which is very concerning. But I think it's actually the peak of the first wave. It just took time to get to Arizona, and there'll be a flattening of the curve after this. But we're going to see a second spike and a third spike and a fourth spike. Mm-hmm. The question is going to be, can we mitigate that and manage the campus with people on the campus? It's not going to look anything like it did before March 11th. But just to get back to answering your question, the athletes are allowed to come out for individual workouts. And the Pac-12 presidents deliberated on this quite vigorously. And the idea was, with so many of the communities opening up to the athletes, if we didn't allow them to come into facilities and do their own personal workouts here, they're going to be going to Orange Theory or Gold's Gym, and we thought that it was more of a controlled environment on our campuses. So for the next couple of weeks, it'll be individual workouts. And I actually saw on TV, we haven't formally gotten together in a few days, but that there's a plan where there would be 2 weeks of sort of walk through as teams, and then sort of a month training camp, if you will, before, for instance, football would start. But go to the press conference. I'll actually be going so that I learn what the latest is. And
I understand that the first phase are going to be mostly locally based athletes, so that's a great thing.
Yeah.
We're going to take questions from the media, and while we wait for some of the media to ask questions, Dr. Carmona, can you talk a little bit more about this spike that we're seeing and the concerns about it?
Well, we are concerned, and I think the president has outlined it very well. This is not surprising to us because of the less social distancing, people resuming their normal activities. A lot of the social unrest that's happened recently, where hundreds, if not thousands, of young men and women getting together to speak about very important things, has already been said. But unfortunately, the timing is bad for that because it's at a time when COVID is still spreading and they potentially can become vectors. And so when the social unrest began, most of us who are tracking this data knew that within 1 to 3 weeks we'll start to see another peak because of people coming together in large groups. And as the president said, we expect it'll drop down again, but we're probably going to go up again. And a lot of it will depend on people aggregating. And hopefully, the more that they practice the good public health habits that the teams have put together, I think we can mitigate that and reduce the risk as much as possible.
Great. We're also following a Twitter feed here, and one of the questions is, it's great that the University of Arizona is doing so much to mitigate the dangers, but you can't follow these students home, and you can't make them do anything. Who wants to take that question? How do you handle the students and their need to be free and their need to be independent?
Nancy, I'll happily take that one. Such a great question because it's so true. In truth, we don't, our students are adults. They're going to make their own choices. But what we can do is educate them about the best public health practices to keep them safe, to keep their communities safe, to keep the people they live with safe. And one of the great ideas that our faculty came up with is to develop a cadre of student ambassadors who will speak peer-to-peer to the value of following good public health practices and to make sure that our messaging really reaches students at where they are. So that means through social media platforms, through the use of humor, where we can use humor to convey our messaging, to use memes. There's already been a lot of work to develop Wilbur and Wilma mascots wearing masks, so that's going to be an important part of our messaging campaign around public health as an example. But it's going to be very much a multifaceted approach because we have to change hearts and minds. It's not enough to tell people, well, it'd be good if you did this. It's like it'd be good if you took a vitamin every day, right? It's like, okay, good, whatever. But we have to change hearts and minds so that ultimately people absorb new practices, new ways of moving through physical spaces, new ways of thinking about their own hygiene in terms of, I've got to wash my hands 10 times a day, I've got to wear my mask everywhere I go. These things are going to take practice because they're habits, and it'll take a lot of effort to develop the habits. I don't know how many times I've stood up from my desk and had to turn around and go back to get my mask.
Right.
So I'm not in the habit yet of automatically grabbing it. I'm getting better, but it's going to take time. It's going to take practice by all of us.
How is this for instant feedback? Somebody said, yeah, I hear that you're going to have peer-to-peer counseling. Does that mean that you plan to just shame the students into wearing their masks?
No, I think that any public health expert would tell you that shame is not a useful strategy to bring to this table. This is all about encouraging people to support each other to be as healthy as we can all be. Right. Shame is not part of this game.
Wonderful. We have a question from the media. Go ahead.
Dr. Robbins, hopefully I'm not too muffled here.
No, loud and clear.
I'm assuming you've probably seen the letters and heard from some of the faculty members who are expressing reservations about how quickly you're looking to open, expressing reservations about the chance of aggravating spread, not just through the university, but through the communities at large. What do you say to those concerns?
Yeah, we hear them. We're concerned about them as well as they are. And I think that what you're seeing is a system that's been put in place. Liesel and her team have been working for months now with broad domain experts from across the university to get us to a plan. And Rich and his team have come in to partner with Liesel to help operationalize any plan. But most importantly, to make a decision, do we think that that we can provide the protection that would allow those who choose to come back to campus. And there will be a big component of choosing to come back or not. Then that it will be an environment that we can never ever eliminate the risk to zero. So how much can we eliminate risk and make it a workable environment? As I said before, it's going to look totally different. There's going to be guidelines and suggestions about requirements for face covering in certain places, conduct in classrooms in terms of social distancing, all of the good public health guidance that we've heard from the CDC and the WHO and HHS. So those are the things that we're trying to work on, and I think every other university in the world is trying to work on this.
It sounds like to some degree you're offering that right to choose to a young population sometimes tagged as having that feeling of, I'm immortal, I'll be okay.
Yeah.
How do you make sure they're going to make a wise choice for the broader population?
Yeah, well, that I think Liesel hit right on it, and some of the comments Rich made earlier is this is about educating individuals to not only, as I've said before, assume you've got the virus and assume everybody that you come in contact with has the virus. So stay as far away from each other as possible. Cover your face if you can't stay as far, a social distance of at least 6 feet, but probably more. Wash your hands frequently, and I think vigorous, aggressive testing, which we plan to do, contact tracing, and then treating of individuals that test positive are the only way that we will know who has the disease and how to take care of them and the general public at the same time.
Thank you.
Thank you, Craig. While we wait for other media or other folks in the audience to ask a question, the microphone is right up there. We ask that you keep your masks on, though. I'm getting another Twitter question, and it says, Harvard has decided not to open for another year. What is the difference between Harvard saying it's not safe enough and the University of Arizona saying, we're going to try it?
Yeah, I'll take that. Harvard made this decision early on, and I understand why they've done that. I think they're in the minority of higher education universities across the country in making that decision. And so they have their reasons, and certainly the safest thing to do if you didn't want to get COVID is just stay at home. And so the question, and I think you were getting to it, is are we promoting an environment where individuals are going to get sick and potentially could die? Well, we're trying to study that. And we, along with every other university, every company, every institution in the world is grappling with these questions right now. And there's no right answer, but I would say that Harvard is in the minority as we look across the landscape and talk to our peers all across the country. So to make it seem that we're doing something reckless and without thought and meticulous attention to a process to study and understand, I think what the ramifications are. I think it also depends on your local environment. If you're a university in a rural environment where there have been very few cases, probably safer there than it would be for Columbia University in the middle of Manhattan.
Right.
Or NYU, and NYU, by the way, has said they're coming back.
Wow. We have another question from the media.
Thank you, Nancy. I just want to make sure you guys can hear me.
Yes.
Good. Dr. Robbins, this to you. Some of the faculty they're concerned about a furlough plan and potential layoffs coming up in the next few weeks or a little bit down the road. I wonder how you can quell some of those concerns, and if you, sir, can expand on what the furlough plan is.
Well, I think that we've published the furlough plan. It's a fairly aggressive plan that mitigates, I think, about 72 million of the projected $260 million shortfall, of which we've already, through rebates, through students withdrawing, through loss of auxiliary income, we've already experienced more than $50 million of loss just from what we did in the spring. Going forward, the projections are over $260 million. The furlough plan is a plan that gets about $70 million of that 265. There are other things such as we're not building important research buildings. There are three major buildings, the old chemistry building for collaborative active learning space, which we are all very, very excited about. The Applied Science building and the Grand Challenge buildings have all been put on hold. Merit increases have been put on hold. The strategic plan that we worked so hard on and we're excited about, investment in those those initiatives have been cut back. At the end of all of that, even though we have a very aggressive furlough program, and just today in the Chronicle of Higher Education, there are over 250 universities. We were out on front with this, took a lot of heat for it, but why are we going out when nobody else is doing it? As I predicted, over 250 universities now have had to make major pay reductions, layoffs, furloughs. Even, we were asked about what's going on in our own state. Well, now you see that these things have happened, and about 60% of these 250 reduction in salaries have been furlough-based because we're trying to preserve jobs. Our goal with this was to try to keep as many jobs as we possibly can.
Quick follow-up, that 260 million shortfall, is that projected over the next year, sir?
15 months, so it's 3 months of the fiscal year we're ending right now, and then projection for 12 months in the future. And that's a best case scenario. That's if students come back in the face-to-face mode. We've projected that 25% of out-of-state students will choose not to come back, and 80% of our first-time international students wouldn't come back. So if we make the decision to go all remote learning, continue as we did in the spring, that number gets to between 400 and 500 million.
And that's a majority fiscal year 2021.
Yes.
Thank you, sir. Thank you, Nancy.
Sure, thank you. While we wait for more questions, another Twitter question, and we have time for one more media question. They're saying that across the internet there is a campaign for students to take a year off and go do some public service somewhere, that it would do them the best. Yeah. And I guess this question can go to anyone on the panel. If the University of Arizona was to say, let's take a year off, everybody go home, come back in a year, what would that look like when students were ready to come back? How could you stand up a university? How could you stand up a medical school if that happened?
Well, maybe I think it's a matter of choice. Mm-hmm. I think that anybody that says, let's shut, the College of Medicine down for a year isn't allowing for students to make choices about their careers, about their futures. So it's a hypothetical question to me. It's not a real question because I don't think we would ever feel entitled enough to make that type of decision for our students.
Anybody else want to take a shot at that?
I would just
Go, Betsy.
second that our students involved in research, and we have a large number of them, would be deeply, deeply
Harmed.
harmed and disappointed and angry probably at the inability to participate in that research.
Liesel?
I would say that I love the idea of a public service year, but I am worried about how individual students and families would sustain themselves through that process when we see the economic turmoil that the pandemic has wrought in our communities in Arizona, but across the nation. This is a very deep, deep financial hole that the country is in and will emerge into when we are moving out of our stay-at-home orders, and I would struggle to see that people will find that easy in this climate. It sounds like a lovely idea, and for some people it will be a lovely idea, but in many cases and for many of our students and their families, the university is the safe haven that will shelter them
In the
through
future.
an otherwise incredibly difficult period of their lives.
Dr. Carmona?
I agree with my colleagues. This is such an important question, and we must remember that besides all of the great research and the academic prowess at the University of Arizona, it is also an economic engine for this community. It's the largest employer. The research is used every day to better public health, to better care. So it's endless. So, like my colleague said, it's too important to do that, and yet it is a student's decision. But the best we can do to support our community is to stay in business because of all the reasons that have been mentioned.
Wonderful.
Yeah, Nancy,
Yeah, go ahead,
before we get to the other question, I would agree with everything that's been said. I also think and I talk to hundreds of students and families. Overwhelmingly, people want to know. I mean, I can show you texts that I was getting late into the night. Is it going to be available for our student to come back? Casey and I met a young man in California on one of our visits who we Zoomed with for 30 minutes talking about some of the challenges he has, but he's committed to coming back in the fall. I would say I love the idea of a domestic Peace Corps type of program where individuals could work as contact tracers, could help serve as help to our most vulnerable communities and individuals. And I think that I would be supportive of that. And, if one of my children said that's what I want to do, I would think that's great. I think there's an opportunity actually here at the University of Arizona to do that. And we've heard from Dr. Cecilia Rosales has a great idea about engaging and getting students to be ambassadors around contact tracing, around peer-to-peer education about what is a virus. How does it get in your body? How does it infect you? What are good public health things? This is as Mike was saying, a great teaching moment, even though it's a devastating pandemic and a crisis. We're going to go on like this for this entire academic year. And I'm predicting it will be into next academic year until we get a vaccine. And, we can get Mike and Rich to comment on what they think about vaccine. I think Dr. Fauci has been more optimistic than I would have thought he would be about maybe he knows something that the rest of us don't know about a vaccine. But then even if we get a safe vaccine, as I've said many times, you've got to manufacture, you've got to distribute, and then you've got to administer at least 300 million doses just for this country, probably 600 because it'll probably require a booster. And then you're talking 14 billion doses to cover the globe.
And I know that Dr. Rosales is talking about putting together a multi kind of group where there's Spanish speakers, where it's multilingual, so that the students are outreaching to other students in their own language that is most comfortable to them. I think Craig Smith from Channel 9 had one more question.
Doctor, is there a scenario where the trend in the virus or some other factor gets to a point where you go, as much as we wanted to reopen, we're going to leave it as it was in March?
Yes, there is. I can't tell you exactly what that is, but I can tell you if we were coming up to a situation and our hospitals in southern Arizona looked like they did in New York City at the height of the worst devastation of any site in the world, we wouldn't be opening this campus. It would overwhelm. So I think we've got to be able to do the best we can to provide maximum protection, to be able to identify, and that's why testing is so important, identify those individuals who have the virus. So every symptomatic person will be tested, and we'll offer tests to everyone, starting with the antibody test, but more importantly, looking for viral testing so that we know if someone's infected, because I could be negative today, but could get the infection tomorrow. But unless you test, you're not going to find it out unless I'm symptomatic and I come forward. So if we can't adequately isolate individuals, we get so many cases that we become overwhelmed with the facility we've designated to isolate individuals. And if right across the parking lot, banner is all ICU beds are filled, all ventilators are being used, they're in the halls like you saw in Italy and other places, we wouldn't open the university.
I think Colin addressed this to some degree, but what's your take on the discussion of, do you really acquire immunity? Do you acquire immunity that's truly lasting? Does that really, what does that mean for the prospect for a vaccine or not?
Yeah, I think that we don't have enough science yet to firmly establish that. But as I've said many times, and the fact is the antibody tests we're doing, the number of people that are testing positive is very, very low, consistent with the Stanford and the USC data. Now, in New York City, it's a different situation because it was the epicenter of the globe. So 20% of people tested positive for the antibody, which means they've had the infection. I think it's informative to us to understand that in our community, and it's really, really low in the people we've tested. I think statewide, we're now over 12 to 15,000 individuals that have been tested, and those rates of positivity are low. It does help us in terms of when a vaccine does come around. But just to answer your question about, my personal opinion is this is a novel virus, but it's a coronavirus. And Dr. Abacasas actually did his master's thesis on coronavirus a long time ago, but still, still knowledge that he acquired. So with MERS, there was about a year's worth of protection through antibodies. With SARS, it was up to 3 years. So you would expect that if you test positive for antibodies and you're producing antibodies, and one of the things that our researchers, I think, have done brilliantly is set the level for a positive test in testing for 2 different proteins and using neutralizing a neutralizing test to mean that if you've got antibodies, those antibodies kill the virus. They tell me, and I believe the biology from MERS and SARS will hold true, and we'll look back and find out that if you did have antibodies, if you were infected and produced antibodies, then you would have immunity. Where are the cases? Where are the case reports of people who've tested positive who've then been reinfected? And I think that tells you all you need to know about this question. But we've got to get the data, and we can only look back and say, yes, they did have immunity. And I think it's so important for us to test our community to find answers to those questions.
Thank you, Dr. Robbins. And thanks to all of you. I know everybody is so busy. It's time for you to get back to work and find some solutions. We've come to the end of our time together. I want to remind everybody at home watching this on Facebook that you can watch it again anytime at arizona.edu/live. Send us your questions. We're happy to try to address them as well as we can. This university, under the leadership of Dr. Robbins, is committed to transparency. And it's not always easy, and we don't have all the answer, but there's a lot of effort going into this. We will be back next week at 10 o'clock, probably from another location, but please join us then for more information. Thank you.